everybody. Welcome to our next Tuesday chat. I am Brenda Green with the Be Strong Group, and I'm so glad to be with you. This is another great Tuesday with another great topic. Again, I'm Brenda Green, founder and CEO of the Be Strong Group that we founded in honor of our son, Braden, who has sickle cell disease. And our mission is to spread awareness of sickle cell disease through education, advocacy, and empowerment. And as you know, we are bringing these Tuesday discussions to you, and typically they're for topics that are important to those with sickle cell disease as well as caregivers. However, some topics are applicable to everyone, but we wanted to make sure that we share and educate our listeners, our community on different topics that apply to us and that are important. And tonight is no different. Tonight, we're going to be speaking with A.K. Burch, Dr. A.K. Burch, with our own Prisma Health Children's Hospital. And she's going to talk to us tonight about the COVID-19 vaccine in children. And I just want to remind you that our discussions, especially tonight, are for educational purposes only. We're so excited to have Dr. Burch because this is her area of expertise. She is a professional, and we're so pleased to have her. And if you need any additional information that's specific to you or to your child, we will ask that you seek advice from your primary care physician or your child's primary care physicians. But again, we're so excited to have Dr. A.K. Burch with our own Prisma Health Children's Hospital, where she serves as the division director of Pediatric Infectious Diseases. Thank you, Dr. Burch, for joining us tonight to talk about a very important topic. But before we get started, can you please share just a little bit more about yourself to our listeners?
Sure, I will. Hey, everybody. So glad that I've been invited to do this tonight. And thank you so much for having me. I want to tell you a couple of things. Number one, I'm still at work. You can see I'm in scrubs, and you can see my awful office in the back. And I apologize that it's not a pretty view behind me, but we are keeping it real tonight. So, and I have no makeup on. I am from South Carolina, born and raised. I'm actually from Greenville. And I went to the College of Charleston undergrad, and I did my medical school at USC here in Columbia. I did my pediatric residency in Greenville. And then I did my pediatric infectious disease fellowship at St. Jude and Le Bonheur in Memphis, Tennessee. And then right after my fellowship was complete, I always knew I was going to come home. South Carolina is my home. I was hoping not to live anywhere else. And so I got a job here in Columbia, and I've been here ever since. I currently live in Camden, South Carolina, and drive into Columbia every day here to the Children's Hospital. So we are hopping in the Children's Hospital. It's not all COVID. It is a conglomeration of different infections or problems, really. So, a lot of times during this time, we have, normal pediatric problems that we see in the hospital. And on top of that, we have RSV, we have adenovirus, we have parainfluenza virus, which are kind of later. They've been delayed a little bit. And then we have COVID on top of that. So it's been really busy here. So this is a great time to be talking about COVID-19 and about the vaccine itself. And I would love to answer any questions y'all may have.
Oh, thank you. Thank you so much, Dr. Burch, because, of course, especially with some children already going back to school, the fact that, they're returning to school in the midst of a pandemic still. And we have these important discussions going around with the COVID vaccine, period. But I felt like it's a good opportunity to talk about it as it relates to our children. And you guys, I'm still so excited to have Dr. Burch here. We appreciate her. It's a blessing to have her. And I'm honored to have met her years ago. And And for those of you who follow me, who know me personally and follow the Be Strong group, you know that I am for vaccinations. And, and that's one of the areas where I met Dr. Burch as well. But Dr. Burch, we received some questions. We have some questions for you. And I'm just going to read the questions off. And if you can answer them. And for those of you who are listening, if you have any questions that you haven't heard, or if you think of one, just put them in the comments and we'll get to them. So I had a question and comment from a parent who said, I am concerned that the vaccine hasn't been studied enough on children. Can my child just wear a mask?
Mm-hmm. So that is a question that I actually get quite frequently. I will just tell you quickly overall, I know that there's been some concern about the type of vaccine that the COVID vaccine is. It's what we call a messenger RNA vaccine. And it is the first time that a vaccine has been made with this technology. But I will tell you that the technology is not brand new. It's been around for a long time, and we've used the technology mainly in cancer therapies, but other places as well in medicine. It just is the first time it's been used to generate a vaccine. And so I want to say that to kind of relieve some fears, because I think that people worry about that this vaccine was just pushed through so quickly, but really was able to do that because that technology was already in place.
Okay. What was that name again? I'm sorry.
Oh, it's a messenger RNA vaccine. And so both of the Moderna and the Pfizer vaccines are messenger RNA. And obviously, we're going to talk about that because the Pfizer vaccine is the one vaccine that is currently approved for children. So that being said, yes, it has been studied in pediatric patients, and it has been shown to be very effective and very safe in pediatric patients. Obviously, this is for 12 years and above, right? That it's currently being studied in children less than 12 years of age, and we're waiting for all of that data to come out, but have no reason to think that it wouldn't be approved to be able to be used in younger children as well. My children have received the vaccine, and they have done very well with it. Of course, with the vaccine, you're going to have some kind of side effects. You're either going to have a sore arm or you might have some fever. My girls, after the second dose, actually had some aches and didn't feel very good for a day. But that doesn't mean that you're actually getting the virus from the vaccine. And that's really important to know. It is your body's immune response towards the vaccine itself.
Right. That was a good point. My son as well has been vaccinated. He's fully vaccinated. And he did spike a fever after that second dose. But he's fine over 2 weeks later. So we're good.
I do want to address one thing also when it comes to this, because I think it does come up with, is the vaccine safe? I'm not sure that if y'all have heard that some younger adults and older adolescents have had what we call myocarditis after the vaccine. Typically, it's after the second dose of the vaccine. Mm-hmm. That myocarditis, what that name means, is just inflammation of the heart muscle. Okay. And so the people who have gotten myocarditis after the second vaccine, it's been very mild. The majority of the patients had no hospitalization or only one day. It was taken care of with no medications to maybe some anti-inflammatory medicines. And when you're looking at what we call risk versus benefits of getting the vaccine or not getting the vaccine, one of the things that can happen in children and younger adults is if you get COVID, you have the chance of getting MIS-C, which is that multi-inflammatory syndrome in children. That's the process that can happen several weeks after the COVID infection itself. And Kids who get Miss C, one of the big things that happens is you get a very big myocarditis associated with it. And it has nothing to do with the vaccine whatsoever. So when you look at the vaccine versus getting myocarditis from Miss C, it's much better if you're going to get a small myocarditis from the vaccine than it is to get myocarditis from Miss C. So just to kind of help you out with a little bit of those questions, whether or not the vaccine is safe. Again, those ones that we have seen where, patients get the myocarditis from the vaccine, it's rare and it goes away on its own.
Okay. It goes away on its own. Okay. All right. Thank you. Thank you for mentioning that. Okay. Another question is, if my child is vaccinated, is it safe for her to not wear a mask?
So I think when the vaccine first came out, it was safe to not wear a mask. Now the CDC recommends for all people, whether vaccinated or unvaccinated, when they're inside to wear a mask. And I think that we need to try to follow that recommendation as best we can. The reason why wearing a mask is still there is because, number one, the Delta variant of the virus is what is predominantly circulating around the United States, and it's absolutely the predominant strain that is in South Carolina right now. That particular strain is more contagious than the original COVID strain. And even though you might be vaccinated, you still have a chance of actually getting COVID, okay? The important thing to remember, though, is when you're vaccinated, you're most likely not going to get hospitalized and you're most likely not going to die from COVID. And that's the benefit of getting the vaccine. So that being said, it is recommended that even though your child might be vaccinated, they still wear a mask.
Okay. Right. Now, do you want to take questions as we receive it in the comments, or
Sure.
Just do that to make sure, just in case it's related to whatever you're discussing.
Sure.
So we have a comment from Naomi, one of our listeners. I've heard parents say they rather take the chance of their child getting COVID because it's better for them to build natural immunity instead of vaccine. Is natural immunity better?
So that is a great question. I'm not sure we know 100% which one is better. Okay. So even in the studies that have looked at natural immunity, that natural immunity ends up what we call waning over time, potentially. So either way, it is better for people to get vaccinated and take their chances of getting COVID or not getting COVID, even if they're vaccinated, because what the vaccine does for you, especially if you're in high risk for having bad outcomes with COVID, is it keeps you, like I said, out of the hospital and it keeps you alive. Okay. And those are the two really big things. That's the main focus that we should be looking at with the vaccine. Yes, it is good for all of us to get the vaccine so we can have a herd immunity 100%. But it also needs to be used to protect us from getting hospitalized.
Right. Right. And, from my perspective as a parent of a child with a chronic illness, who is a little more susceptible to respiratory illnesses. This adds a layer of protection to, I would say, to allow his body the time to recover and to allow his, like, if he needs hospitalization, to allow the doctors to be able to treat him appropriately. So that was one of the things that weighed on our decision as well.
Well, absolutely, especially for your son, because he falls into that category of having, people with sickle cell definitely have issues with respiratory infections, but also has a a chance of having a poor outcome when it comes if they get COVID. And so it is essential. And I'm so glad that you got your son vaccinated because you're giving him the best chance to have a good outcome if he does get COVID.
Right. So we'll try not to claim it.
Oh, yeah.
Okay.
Don't claim it.
Right. Okay. And I think this kind of touches on what we've already discussed a little bit, but I just want to read the question. Does having had COVID make my child immune? If you just want to just follow up again with that.
Yeah, so getting COVID will give you immunity. We don't know if it's lifelong or how long that immunity lasts. So it is still recommended to have your child and yourself vaccinated, even if you have had COVID. Not only can it help with the potential waning immunity, but it can also boost that immunity as well and give you extra added protection.
Okay, thank you. So my child normally gets the flu shot every year. Can they get that and the COVID-19 vaccine? And will the flu shot help prevent COVID-19?
Okay, so yes, you can get the flu shot and the COVID vaccine shot together as long as it's not what we call the live attenuated vaccine, which is the flu vaccine that you can get through the nose. So you can't do live vaccines and COVID together, or we try not to do that. But yes, they can get together. Can get them together. The flu vaccine will not protect you against COVID. All it will do is help protect against the flu. But it is so important to do both of them, y'all, because influenza, we know, can absolutely make kids sick, and that can make them end up in the hospital as well. So just like the COVID vaccine, which really helps to prevent hospitalizations and deaths from COVID, the flu vaccine does the exact same thing with influenza. So sometimes you can still get influenza even though you have the vaccine. The point is that you stay out of the hospital and you don't die from it if you get the vaccine. And that's the important part.
Absolutely. Okay, so who should I talk to get more information about the risk of my child with a chronic illness getting the COVID vaccine?
So I would say two people. Number one, your primary care physician. So pediatrician, family medicine physician, whoever you see for your primary care, your child's primary care will be a great place to start. Pediatricians know a lot about this vaccine and can answer any questions that you might have about it. The other person that you can talk to is the specialist physician who helps care for your child with the chronic condition, whether that be a neurologist, a pulmonologist, an hemonc doctor, an infectious disease doctor. We also can give you more detailed information about your child's chronic condition and how it relates to COVID-19.
Okay. So as we should be doing anyway, we should talk to our primary care, your child's primary care, as well as their specialist. You see. The next question is, what can I do to be sure my child feels okay after getting the COVID-19 shot? Can I give her Tylenol before getting it?
So that's a good question as well. Basically, there was initially some data suggesting that if you give Motrin or Tylenol before your child gets the vaccine, it might blunt the response. So typically, we don't necessarily recommend doing that. Basically, if your child gets the vaccine and they start feeling bad, then you can try the Tylenol or the Motrin if you feel like they need that. But typically, feeling bad after the COVID vaccine is very short-lived. It could be several hours to less than 24 hours. So it's a pretty quick thing that kids get over And so trying to get through without any medicine is probably the best way, but you're not going to harm your kid if you feel like you need to give them Motrin or Tylenol after the vaccine.
After the vaccine. Okay, good. Is the COVID-19 shot causing the increase in RSV cases with children here in South Carolina?
So RSV happens every year. Okay. It is something that is a rite of passage with pediatricians. We see it all the time, but typically we see it in the winter and early spring months. Okay. What has happened with COVID is that we have been very good about wearing our masks, right? And COVID has been the predominant virus that's been circulating around. So when the COVID numbers went down and we got to take off our masks, it allowed for other viruses that we typically see in the winter times to then come out in the spring. All right. So if you look at RSV, this winter, it was zilch. It was such a small number of hospitalizations or infection problem that kids saw this winter, when normally we would be seeing a lot of RSV during the winter. So basically we're not seeing an increased number of RSV cases overall. What we're seeing is the RSV cases happening now instead of this past winter. Does that make sense?
That makes sense.
Okay. All right. And so, yes, COVID probably does have something to do with that because we were all wearing our masks and it was the main virus that was circulating at the time.
Okay. But it's not the vaccine, because I think they were asking, is the vaccine?
It's not the vaccine. It has nothing to do with the vaccine at all.
Okay, great. Well, we have a couple of questions that popped up in the chat. Can you address the more kids have died from the flu than COVID debate?
Right. So you have to kind of look at data over time, and it's kind of hard to talk about this. When COVID initially was on the scene, it was brand new. The pandemic started with the original strain of COVID. We had very small amount of deaths in the pediatric population. So at that time, flu actually was more deadly in the pediatric population than COVID was. Things have changed now since that we have the Delta strain. And when I say things have changed, we don't know yet if this strain is more virulent, meaning it's more aggressive in children, or we're seeing more pediatric patients with higher acuity, meaning they're sicker with COVID because more people in general get COVID. That has not been figured out yet, and we're going to have a lot more data before we can answer that question. So I think the take-home message here is that influenza absolutely can cause death in children, but so can COVID. And there are 2 vaccines out there that help this problem. There's the flu vaccine and the COVID vaccine. Both of those vaccines are helpful to keep children and adults who get it out of the hospital and from dying from the infection itself. So that's why we recommend having everyone, if possible, to get the vaccine for both of those infectious disease illnesses.
Okay, great question. And Naomi, let us know if if you need more clarity. But she has another question. How does a family address differing opinions on vaccination from our child's healthcare providers or specialists?
And I'm not sure if you're meaning that your healthcare provider didn't recommend the vaccine or did recommend the vaccine and you were not. So I maybe a little bit more clarification. But I will tell you that COVID-19 vaccination is recommended for anyone 12 years and older. I would hope that your primary care physician would be recommending that for you, but you don't have to get it through your primary care physician. There are many places out there that can supply the vaccine for kids 12 years and older. All right. So, and it says if one does and one doesn't. So if you are concerned about getting your child vaccinated and your primary care physician feels like your child should be vaccinated, that should be a conversation you should have with your primary care physician. And basically that primary care physician should be giving you education so you can make the right decision for you and your family. All right. And so they should answer questions that you might have, provide you literature on the vaccine if you request that, and try to give you the correct answers that you might need to the questions you have so you can make a good decision for your family. If it's the other way around, where the primary care physician thinks that your child shouldn't get vaccinated or yourself, then I think things like this program can help you be educated on how safe the vaccine really is. And there are plenty outlets out there where you can get a vaccine for COVID. It doesn't always have to be in your primary care physician's office.
Right. And it looks like she gave even further clarification and a scenario. Say if it's the pediatrician says yes and a neurologist says, wait, there's not enough information yet. What is it?
Oh, I see what you're saying.
Yeah.
I think it honestly depends upon the case. And I know that that's probably a very, that's a, sounds like there's something actually going on between maybe the neurologist and the pediatrician. I will tell you, and I don't want to go against anyone, but the COVID-19 vaccine is safe. And it is important for children who are 12 and older, especially if they have a chronic disease, to go ahead and get the vaccine to protect themselves from COVID. Because really, we see increased hospitalization and potential death with COVID in those patients who have chronic diseases. Now, that being said, I don't know the particular situation or what's going on with why the neurologist says that. So I think that you just have to gather the information and make the decision that's best for your family.
Okay. Okay, let's go back to our questions we received earlier, and we'll tackle more in the chat. So my son, and this is from a fellow sickle cell mom,
Okay.
My son has sickle cell disease and takes various medications. Is it possible that the vaccine can interfere with his medication, or can antibiotics interfere with the vaccine?
Right. So there is no contraindication, meaning there's no reason why you can't get the vaccine based upon medications that you're on. There should not be any interactions, especially with antibiotics. I can promise you there's no interactions there whatsoever. I think sometimes the question is if a patient is on medications that suppresses their immune system, meaning that your child doesn't have a good immune system to fight off infection. Sometimes children and adults who don't have a good immune system might not make the best antibody response to the vaccine, but that's not a reason not to get the vaccine, because any response is better than no response. And so that's the same for a flu vaccine as well.
Right. Okay. Well, let's go back to the chat. So, Dr. Burch, can you explain how a virus works and how a vaccine impacts virus mutations?
Sure. So, viruses work in different ways, right? But the traditional thought is that a virus actually binds to a receptor in the body, right? And so, for instance, with COVID-19, it binds to the ACE2 receptor. And once the virus binds to that receptor, it is able to be transported into the cell. Then the virus itself takes over the cell and starts producing many versions of itself. And then those virus particles are released out of that cell, and that cell dies. And so that's how our body gets infected with viruses. The vaccine itself is typically is part of the virus particle, but it's not the whole virus, at least with COVID-19 vaccine. Okay. And so what you want to do is have your body make antibodies to a piece of that virus. So whenever your body recognizes that you're getting infected with the virus, they already have the mechanism to produce a bunch of different antibodies to help attack that virus early. Okay. So that's how the vaccine works. Now, the vaccine can impact virus mutations by creating what we call a herd immunity. Okay. So I don't know if y'all have heard this in the news or not, but herd immunity basically means when there is a certain percentage of the population out there that is vaccinated against a disease, the likelihood of that disease circulating around that population is low, much lower, okay? This is part of the reason, or the reason why we don't see measles very often. We don't see pertussis. We don't see chickenpox as much as we used to. That's all because of herd immunity, all right? So Brenda, for your husband or for your child, that's important, right? For herd immunity. Your child is vaccinated, but if other people are vaccinated as well, and we reach that high herd immunity, the likelihood of your son getting COVID or other respiratory viruses is going to be low. Okay. The way that herd immunity helps with stopping mutations is if you have less people get infected with COVID, the virus itself is going to be less likely to mutate. Okay. Because mutations happen the more times a virus makes copies of itself. Okay.
And that was the next question, is for you to kind of touch on the variants. How does a variant or mutation happen? So you touched on that.
Yes. And y'all, I will tell you, and again, I'm just being real. Viruses and bacteria are smart and they don't have a brain. And they are going to find a way to get around antibiotics. They're going to find a way to get around, to be able to infect people easier. It is somewhat survival of the fittest, right? So viruses absolutely want to infect because they want to make more copies of themselves. And so if a mutation happens, just happens in nature, and that virus becomes more infective, and more people get infected with that virus, then that particular strain of the virus is going to hang around longer. And that's basically how mutations happen and how strains occur and how certain strains get passed easier than other strains. It all has to do with, is that virus is it easier for a person to get infected with that virus? And that's what we're seeing right now with the Delta virus.
Okay. And Dr. Burch, we know you're working. You're at our local children's hospital.
Yes.
And we don't want to keep you long, but we just have, if you have time for a couple additional questions, just a couple. Sure. I know you mentioned about the importance of, well, let me back up. You said the technology with the Pfizer and Moderna vaccines are the messenger RNA vaccine.
That's correct.
And that has nothing to do with modifying or changing your DNA, correct?
No.
Okay.
So what happens with a messenger RNA vaccine is that the piece of the vaccine is what we call messenger RNA. And the way that proteins are made is that your nucleus creates genetic material called messenger RNA that goes outside of the nucleus. Then there is protein synthesis hardware, right? So proteins, we call them ribosomes, that attach to that messenger RNA that makes the protein. Okay. So this messenger RNA vaccine does not go in the nucleus. It does not go anywhere near your genetic material. So your genetic material, DNA, is housed in the nucleus. This happens outside of the nucleus. So it never inserts itself anywhere in your DNA. All right. All it is a little snippet of information that our ribosomes can make a protein, right? That's part of the virus that our body can make antibodies against. And that's it. Once the protein is made, that messenger RNA disappears. It gets degraded and tore up in basically in our cells.
Okay.
Yeah.
And you mentioned the vaccine is safe.
Mm-hmm.
What is your recommendation? And because we advocate for those with sickle cell disease, and we provide education to caregivers as well. So, what will be your recommendation for a caregiver of a child with a chronic illness or a child with sickle cell disease who is hesitant to getting the vaccine? And when we already said it's safe, what would be your recommendation to them as far as them as the caregiver for that child to get the vaccine importance?
Yeah, no, absolutely. It is important. It's important because of the herd immunity that I already talked about, right? So the more people who are vaccinated, it decreases the amount that circulates of the actual virus that circulates in the population, okay? Especially if your child is not at age that they can receive the vaccine, it is so important for caregivers to be vaccinated. The reason why is because, number one, you don't want to bring COVID into your household, right? And so getting vaccinated is our best chance of not having that happen. But number two, if your child happens to get COVID, you don't want to have COVID, or you want to have a mild version of COVID so you can help take care of the child that might be sick, right? And then thirdly, I think that by getting yourself vaccinated, you are ultimately helping to protect your child, but you're also giving them a good role model of getting vaccinated for your child, right? So if you have a chronically ill child that's 17 or even 18 who can make a decision on their own whether or not they get vaccinated, they're going to look to you. If you're not vaccinated, they're going to say, well, then why do I need to be vaccinated? So just being a good role model as well.
Okay. I think that's it. We do have a comment. We do have another comment, and I will read it. I know you can see it too.
I'm reading it right now.
And just for our audience, I made what I call the best worst decision, and my son is vaccinated. He has chronic lung disease, LGS, epilepsy, CP, etc. It was unnerving, but he did excellent with the vaccination. The risk and potential outcome of him getting COVID-19 or variant would be worse than potential side effects from the vaccine. And she says she's just sharing for other families that might be on the fence.
Naomi, that is such a great way of putting that. It really sums up why we are here. You looked at the risks versus the benefits for your child on getting your child vaccinated. And in the end, the benefits of getting your child vaccinated outweigh the risks by far. And mainly, because your child, unfortunately, if they got COVID, your son, they have a good chance of ending up in the hospital. So you did the right thing. You really did. By the time kids get to me in the hospital, I have medicines that I can use. But viruses are harder to kill and get rid of. They have to kind of run their own course. versus bacteria, where I can give antibiotics and they're going to get killed very quickly. So viruses in themselves are harder to deal with than bacteria is. And so you really did make the right decision, and I'm proud of you. And thank you for sharing that. For everyone else who's listening, who's on the fence, this is very helpful, I think, to them.
Oh, yes. And I think so. We appreciate you, Dr. Burch, so much. These are never, and I can speak from the perspective, I can relate to Naomi's comment,
Mm-hmm.
because as a parent of a child with a chronic illness,
Mm-hmm.
we make so many decisions.
Mm-hmm.
And a lot of the decisions we feel could be life or death. And they're not always easy. And we have to weigh the risk with so many things. So with this, when it came to COVID for us, whether or not to get the vaccine, of course, as usual, we consulted with his physicians, with his specialists. We prayed about it because we are a faith family, a God-fearing family. And we had to weigh the risk to do what's best for him, to give him the opportunity to live as best his life as he can, So this is just one of the many decisions. And again, I thank you for taking time out of your busy, busy day. We've had to pop into the Children's Hospital recently, and we know it's not empty. We know you guys have a lot on your hands. We appreciate all that you do. Thank you for advocating for our children. Thank you for sharing this information. And we want it to be educational to our listeners so that they can think about it and have some information that is coming from someone who is living it right now. Like you said, it's real life. And someone who has the expertise and the knowledge. And so you can be able to make the best informed decision for you and your family, and know that your decision as well can impact other families.
Absolutely.
Especially families like ours. We can only control what we do. And so thank you, Dr. Burch. One last minute question, Dr. Burch. Booster shots.
Yes. Okay. I have a feeling, it has not come out yet, but I have a feeling that we're headed for booster shots. It's already recommended for immunocompromised individuals. It's going to be pretty soon when the general public is going to have recommendations to get boosters as well. And I have a feeling it's probably going to be sometime around the time that flu vaccines come out, so you can get both of them at the same time. So be on the lookout for that. I will be the first to sign up for my booster shot. I will tell you that there has been breakthrough cases that we are seeing actually in healthcare workers who are around COVID all the time, who got vaccinated in December when it first came out. We're starting to see waning immunity, and people are getting breakthrough cases. So I'm waiting to be able to get mine.
Okay, great. Okay, so I got a feeling the longer we go, the more questions. But I wanted to mention, I wanted to mention that if you're listening on replay, you can still ask a question. I will email them to Dr. Burch to get her response, and we'll get you an answer or a comment. And again, thank you, Dr. Burch. Thank you to everyone who has listened. Thank you for joining us on our Tuesday chats. We appreciate you so. Again, our mission is to spread awareness of sickle cell disease through education, advocacy, and empowerment. And knowledge is empowering. So we learned a lot tonight. And Dr. Burch, I want to be sure, I know you left us with a lot of what we call gems, but is there any last minute message you want to send out before we wrap up?
I would tell you that COVID is out there. It is very, very much out there. Adolescents who have comorbidities are at the highest risk from the pediatric population to get admitted to the hospital. That is the most important people to get vaccinated. Obviously, we all need to get vaccinated, but if you have a child at home who has comorbidities, and that even includes normal kids who are obese, all right, please consider getting them vaccinated, all right, because actually obesity is the number one comorbidity for bad outcomes with COVID-19. So just like adults who are obese or have hypertension, their risk of having bad outcomes with COVID is much higher. It's the exact same thing in teenagers. Okay. And so please consider this for you and your family and your children if you meet that criteria to be able to get the vaccine, because it really could save you and your child from being admitted to the hospital. Um, COVID is real and it can be bad. I'm not trying to scare anyone. I'm just trying to get the information out there so you can make the right decision for you and your families.
Oh, absolutely. So, with that, you guys, you have the information. You can listen to it again. Again, if you have any questions, any additional questions, put them in the comment section. We'll get you an answer. And once again, we appreciate you so much, Dr. Burch, for your time. And so we say good night to everyone and thank you for listening. Good night.